Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. High-risk HPV affects male reproductive health. A new study published in the Frontiers in Cellular and Infection Microbiology indicates that high-risk HPV positive men had a higher percentage of dead sperm, leading to infertility in men. Cervical cancer, the fourth most prevalent cancer among women, results in around 350,000 deaths annually, predominantly in middle and low-income countries. Human papilloma virus infection is responsible for 95% of these cases. Public health officials in 37 countries are currently administering vaccines to girls aged 9 to 14. HPV is known to raise the risk of genital warts and cancers of the genitals, anus, mouth, and throat in infected men, which is why the WHO and the US Centers for Disease Control and Prevention recommend routine vaccination for boys as well. Weight loss drugs, cardiovascular benefits for heart failure patients. A new study published in The Lancet found that the anti-obesity drug semaglutide might aid in preventing heart attacks and other significant cardiac events in overweight individuals with cardiovascular disease, regardless of whether they also have heart failure. This study discovered that a subgroup of participants diagnosed with heart failure experienced similar cardiovascular benefits from the treatment. This diagnosis was made by a clinician at the beginning of the trial. The researchers analyzed data from 4,286 participants out of the 17,605 in the significant semaglutide and cardiovascular outcomes trial who were randomly assigned to receive either semaglutide or placebo. Gut microbiome essential for managing type 2 diabetes, study finds. A paper published in the journal Cell, Host and Microbe examined the influence of the gut microbiome on the onset and management of type 2 diabetes. The review highlighted how the gut microbiome plays a crucial role in the disease development and its treatment strategies. Type 2 diabetes is a multifaceted disorder and scientists continue to investigate its underlying causes. There is growing interest in exploring how the gut microbiome influences the development of type 2 diabetes. Type 2 diabetes frequently features insulin resistance, a condition where the body cells do not effectively respond to insulin, a hormone produced by the beta cells in the pancreas. The gut microbiome consists of microorganisms, including bacteria and viruses, present in the digestive tract. It plays a role in various systemic metabolic processes, and researchers are increasingly investigating how it contributes to the development of metabolic diseases. Predictive power of blood tests for chronic age-related conditions. Recent research featured in Nature Medicine highlights a study by researchers who have created a blood test that analyzes more than 200 proteins to determine a person's biological age. The research indicates that the test, which was developed using machine learning techniques, can forecast an individual's risk of developing 18 major age-related diseases and their likelihood of premature death from any cause. This study enhances the understanding of biological processes underlying various age-related conditions and sheds light on how genetics and environmental factors impact the aging process. The proteome encompasses all the proteins produced by organisms. The research aimed to develop proteomic aging clock to predict the risk of prevalent age-related diseases. By utilizing proteomics data, scientists can more precisely evaluate aging by comparing an individual's biological functions to their chronological age. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.